All right, today we're going to deconstruct a pretty popular video that's been making the rounds online. It makes a really bold claim that you can tackle varicose veins at home with, believe it or not, just a lemon. So we're going to walk through its logic step by step and break down exactly what it's telling people to do. Let's dive right in.
The video kicks off with this really vivid image. I mean, it's designed to hit home with anyone who's ever felt that heavy, dragging sensation. It's a powerful way to frame the problem, right? This isn't just about looks, it's about a feeling, a physical and emotional weight you're carrying around. And then, boom, it gets personal. It pivots from that general feeling and points the question directly at you, the viewer. It's a classic move, really, trying to make you see yourself in the story, to make a big problem feel like your problem. To really hammer that point home, the video lays out this whole checklist of frustrations, and it gets super specific, the throbbing after a long day, the cramps that wake you up, even the little things like finding yourself avoiding shorts or noticing that brownish tint on your skin. It's all about creating this sense of, yeah, they get it, they know what I'm going through. So that brings us to the first part of their argument. The whole idea here is to frame varicose veins not as some minor cosmetic thing, but as a real, legitimate source of daily pain that messes with your quality of life. Now, this is where it gets really interesting. They start to position their remedy against what doctors usually recommend. On one side, you've got compression stockings, which they call tight, uncomfortable, and just a Band-Aid. And on the other side, there's surgery, which they paint as super expensive and something you might have to do over and over again. By kind of knocking down these two pillars of conventional treatment, they're clearing the way for their alternative. Okay, so if the usual solutions are a no-go, what does this video claim is the actual cause? Well, that leads us right into the second part of their argument, their theory on what's happening inside your body. So according to the video, it all comes down to one single protein, collagen. They define it as the stuff that literally builds strong, healthy vein walls. And then they make this key claim. After you hit 40, your body just doesn't make as much of it anymore. And they present it as this simple, four-step domino effect. It's a really clear chain of events they lay out. First, your collagen levels drop. That makes your vein walls weaker and less elastic. Because they're weak, those tiny little one-way valves inside the veins start to fail. And once those valves leak, blood flows backward and just pulls up, which is what causes that visible, swollen varicose vein. And now we get to the absolute heart of it. This is the big reveal. This section is all about what they call a secret connection between a prescription drug and, well, a piece of fruit you probably have on your counter right now. The whole argument really hinges on this one piece of evidence they present, a drug called Daflon. It's sold in Europe to treat vein problems, and the video uses this drug as the key to unlocking their whole theory. And here it is. This is the big aha moment of the video. They put the prescription drug on one side and a simple lemon peel on the other. And their core claim is that the active ingredients in the expensive pill, these two compounds, diosmin and hesperidin, are actually extracted from citrus peels. So the logic they present is pretty straightforward. If it's in the pill, it must be in the lemon. This one comparison is the foundation for the entire remedy. To really drive this point home, they cite a clinical trial for the drug itself. They claim that 68% of patients in a study saw a significant reduction in their symptoms in just 2 weeks. So they're using this number as proof that these compounds really work. And that leads them to their next big leap in logic, which they frame as this really compelling question. If a tiny bit of these compounds in a pill can work from the inside out, imagine what would happen if you applied them directly to the skin, right on top of the vein. The argument is that this direct approach has to be even better, right? So once they've sold you on the logic, the video shifts from theory to practice. They don't just leave it as an idea. They lay out a very specific step-by-step nightly ritual, and they claim you have to follow it to the letter for it to work. And the details here are supposedly crucial. It's a 6-step process. You start by elevating your legs to get them prepped. Then you take a fresh lemon half and massage it over the veins with firm, upward strokes. They're very clear about that. It has to be toward the heart. Then you let it dry, put on some socks, and go to sleep. And it all ends with a really important warning. You absolutely must rinse it off in the morning before you go out in the sun. So for the final section, the video is all about managing expectations. It kind of balances out its big promises with some very clear warnings, telling you not just what you should hope to see, but also what you need to be careful about. They're not promising an overnight fix. Instead, they lay out this very specific timeline. They say on night 1, your legs might feel lighter. By week 1, the itching might fade. Then by week 2, smaller spider veins could look paler. And by about a month in, they claim the larger veins will feel softer and the discoloration might start to fade. But right after promising all that, they give 3 huge warnings, and this is important. First, you have to use a fresh lemon, never the bottled juice. Second, and this is just common sense, don't put it on any cuts or broken skin. And finally, they advise pregnant women to talk to a doctor before even thinking about trying this. So when you strip it all down, the video's core message is really one of empowerment. It tries to completely reframe how you think about varicose veins. They're not some life sentence you get for aging. They're just a deficiency, a problem that, according to them, you can actually do something about. And that really brings us to the final thought here. The video tells a great story, right? It connects this old-school folk remedy feeling with the language of science and medicine. But it leaves us with one massive question. How does a traditional remedy, no matter how much sense it seems to make, actually hold up when you compare it to rigorous, modern medical evidence? And that, really, is the question at the heart of this whole thing.